So I see it in here.
What? That's what she was telling me too.
Yeah, there's probably a bit of a delay.
Oh yeah. Yes.
Can you hear audio?
Let me see that. Yeah. I can hear you.
Awesome. Okay. Let's now. We want to change the setting on the camera so the audio is going through the XLR. Right now it's going through this mic.
Okay.
It looks straight on the phone. It just looks perfect here. Proposal, we don't have to like say like who exactly was the interview or something. Is that anything?
Hold on.
Hey, Ronan, do you need anything?
Well, maybe. Thinking. Yeah. Let me ask Bob a quick question here. And then I may need your help. It's okay. So we're gonna play video on the projector. I just don't know how the sound is gonna be amplified to. You know what I mean? We've got a video to play. It's gonna be the easiest way to use sound. It's my laptop. It's there. Yes.
Fantastic.
Video. I was thinking now. I don't know how you're gonna hear the sound.
This doesn't have an associated sound.
Yeah. Well, the wireless mic is not associated with this. I mean, we could. I don't want to hold the mic up to the speaker. That probably won't sound very good. That's what I'm concerned about.
Have you tested it? Let's try.
Yajaira. Si se puedo ir in the whole thing. But once the mic's on though, or we're just gonna get sound from there, is that all we want?
We want to get sound from the audio de ellos, not from the camera.
Okay, so it's gonna be that one then, ¿verdad? So once they talk, or You can hear like everyone. So,
You can hear like
Because those mics are on. So that's why you're getting ambient.
from those?
Yeah,
Okay.
that's why you're getting ambient.
Yeah, I just want to make sure that we're not, when I hit that, I don't see it
but
popping.
don't they want
I was
those?
going to say, if there's an audio issue, go into the black mic.
Don't they want sound from the mics though?
Yeah,
Pero it's sound from everyone.
Audio
That's the thing.
input. And
Yeah,
go
but
into, make sure it's on HDMI.
Yeah, so
Oh,
let me
no,
show you
no,
two we're streaming with.
supposedly because when it's
So we're streaming through OBS.
Okay, es porque, I'm asking porque the one I'm on right now, I introduced sound from there, you know, like in the camera, so that's why. Because, you get me that?
sorry, I was in this. Yeah, but we want it from
Porque
the
the mic one, just from the mic one. Like,
Check, check, check.
Hello, everyone. This is the 10-minute warning. 10-minute warning that we will be starting promptly at 9. So grab yourself some coffee, snacks. There'll be one more warning before we start. This is your 5-minute warning. 5-minute warning. 5-minute warning with a couple of announcements.
Hello. If this is a parking announcement, if anybody parked in the lot behind the church, please move your car. Because if you don't, it'll be towed. So again, if you parked in the lot behind the church, please move your car. Thank you.
If you would start moving to your tables now, literally at 9 o'clock we are starting. If you can move to your tables and also make sure that you power down your cell phones. The event is also being live streamed, and there are instructions on the Colorado Senior Lobby website, which is coloradoseniorlobby.org. Again, we are starting promptly at 9. If I can ask everyone to start making your way to tables. Thank you. If I can ask everyone to please take your seats, we are about to begin. I know you're having some great conversations by the coffee, but we have a busy program. Sponsors and vendors, if I can ask you to encourage people visiting you to sit down. People in the back, getting that last cup of coffee, can I encourage you to take your seats? We're doing good, people. We're doing good. Almost everyone is seated. Don't be that awkward last person standing. Hi, friends. That means you. Can I ask you to take your seats? Terrific. Let me introduce you now to Bob Brocker, President of the Colorado Senior Lobby, to kick off today. Thank you. Applause.
Well, welcome everyone. I'm Bob Brocker. Yeah, I can't even say my name. Bob Brocker, President of Colorado Senior Lobby. And we were going to do a Pledge of Allegiance, but I can't find a flag anywhere, so I guess we won't be doing that. Thanks for being here on Senior Day 3.0. Getting here today reminded me of these two characters right here. You remember these, don't you? But now, today, everything is wonderful again. Yeah. So we're all happy. I'd like to take a couple of minutes here to acknowledge some of the folks who have made this event possible. First, would our CSL board members all please stand and wave a little bit, please? Thank you. So my thanks to each of them and to the members of our Capital Gang and to our many volunteers here today from a wide variety of organizations, including the Colorado Commission on Aging, Metro State University, including these folks up in the front here who are running all this high-tech video stuff from Media, and Dr. Cog, Seniors Resource Center, and many others. A special thanks also to Ed Shackelford, who has served as our president for several years before me. Ed's sitting down here in the front. So Ed remains a very active CSL and Capital Gang member. So we appreciate very much his passion and experience. And Ed's wife, Bev, who is sitting somewhere, is the master cookie baker, who she and Ed delivered, 300 or so cookies to the legislators for the last time we were supposed to have this event. Now, the Capital Gang spends many, many tireless hours on behalf of Colorado's older adults. So if the Capital Gang members would just stand for just a moment, please, so we can acknowledge them. Thank you. And a big thanks to Corinne Hall, who is in the back. So Corinne has burned through many barrels of midnight oil, helping us prepare for today. And she did it 3 different times. So you all gotten emails from Corinne, several times as well. So she takes care of all the details that make these things work. And I think it's fair to say that we would not be here today without her, so thank you. I also want to thank my friend Steve Grund, who's a fellow CSL member. I don't think Steve's here, but in any event, I'd still like to thank him. He's a member of the Colorado Commission on Aging, Strategic Planning Group on Aging, and he's truly dedicated to the many facets of aging well. So he's been a huge help in preparing for this event. And thanks to Karen Brown, who could not make Senior Day 3.0. She created the panel that we're going to have today. And then to Janine Vandenberg, our MC, who jumped into this event with both feet, and also because things changed. My deepest thanks to each and every one of the many people who made this day possible. And I also want to thank my darling wife, Judith. Way back there. For her encouragement and patience in putting up with me for the last couple of months in particular. I'd like to begin with a very short story from a guy named David Foster Wallace. Some of you probably have read some of his stuff, and many haven't. So there are these two young fish that are swimming along, and they happen to meet an older fish swimming the other way, who nods at them and says, "Morning, boys. How's the water?" And the two young fish swim on for a bit. And then eventually one of them looks over at the other and goes, "What the hell is water?" So the answer is, it depends. So hold that thought, and we'll come back to it a little bit later. Think about it. So a good theme for today is on the front of your CSL brochure, which you have in your program packet. It says, "Don't just complain about politics, do something." Many of you already are, and we thank you for that. We encourage the understanding and making of public policy and engaging citizens of all ages to impact both policy and taxpayer-funded resource allocation, always looking through the lens of older Coloradans. Last year, our volunteers dedicated over 4,000 hours of their time to making a difference in the quality of life and well-being for aging Coloradans. The Capital Gang is huge in the volunteer time. A lot of that 4,000 hours. Last year, over 700 bills were introduced by the legislators. A bill being a thing that might actually lead to an actual law. About half of them actually make it through the process. So CSL volunteers, along with some help from technology, use that older Coloradan lens to identify those bills most likely to have a significant impact on aging Coloradans and focus our discussions and energies on those. We collaborate with other organizations. We spend a lot of time talking with legislators and other groups to advance and even change our positions. Now, I've used the word older and aging several times, and you may be thinking, what does this have to do with me? I'm not aging. Well, that's like saying you're not breathing. So let's take a quick look at this chart. You ready? So some of you have seen this before, probably, but the thing that's interesting about this is on your left, that's a pyramid. And that was 1960's distribution of the United States age groups. So back there in 1960, I was 12 years old. And one of the leading parts of the boomer generation. And then when you move over to the year 2060, which is, obviously about 40 some years from now, you see that there is no more pyramid. So the point here is that the aging space has grown to a level that it is today, and it is not going to change. If you look down here at the bottom, you see this Generation Z, which is basically, these people are teenagers today. They're the second largest generation living in the United States today. So I sure hope that we don't have situations in another 40 years or so where they're talking about another tsunami, because it's ridiculous. It's just not going to happen. These things are all predictable. So maybe you're thinking you should be just a little more concerned about aging-related public policy issues and saying, so hey, how do I get involved with these CSL people? Is there a secret handshake or something? You can ask any of our board members. They have the colorful CSL name tags. They'll tell you but they won't show you the secret handshake yet. Now, you can ease into what we do. You put your toe in the water, sorry, or you can just jump in. Now, you may be thinking, don't I need some government experience or special qualifications to get involved with CSL? No. That's how I got in. You know, I'm a retired railroader, of all things, so anyone with the interest can get involved. And then you're thinking, well, what about all that strange lingo and all those acronyms? Well, a little personal experience with that. When I first heard AAA, I thought, this. And it just didn't make any sense to me why someone would call AAA for help with a human issue. But then I learned it was this. And there are 16 AAAs in Colorado. Some of you are part of those AAAs, and thank you for all you do. Then there was the first time I heard about Dr. Cog, and I imagined this guy. But that too was wrong. So Dr. Cog is a very big organization here in the Denver metro area, AAA. One Monday, early in my time with CSL, someone was talking about a particular bill and said it was PI'd. And I thought, why would a bill get referred to a private investigator? But then I learned that meant the bill was shot right in the bullseye. Killed for the session, postponed indefinitely. Now, I worked in the railroad industry. We had our own lingo. One example, Gandy dancer. So you might imagine a scene like this. But it's actually these guys, the ones who actually lay and repair the track. Or when I say hoghead, you might picture this guy. But it's actually a locomotive engineer. And those sunglasses are very similar, if you noticed. So every kind of work has its own language and routines, and you all know this. It just takes a little time and effort to learn them. If an old railroad guy can do it, so can you. Now, why do we have this senior day event every year when Lucy is in charge? Now, it's time to remember the fish story. We're all swimming in the sea of a representative form of government, a democracy. Our founders created a structure that surrounds and impacts our lives in so many ways and fully expected that we be a part of it. Yet for many of us, it's like the fish asking, what is water? We're in it, but not noticing it. We each have a choice. Go with the flow, complain about the flow, or work to change the flow. Our form of government, the invisible water that we all swim in, requires citizen engagement. CSL provides an opportunity for engagement for changing the flow. So today's program will make you think. It might even hurt a little bit. Now, back to the demographics again. Just remember, no one in this room will ever see that pyramid shape ever again. Generation Z, as I mentioned earlier, is the second largest generation alive today. In 50 years, they too will have silver hair and wrinkles, which is just too damn bad. And I hope that in 2070, this is not a surprise to anyone. So we know the answer to what is water. What we do now for the older of us is shaping the flow for the younger. And I invite the younger to help us with that. Engage now. What are you waiting for? Your community needs you. Thank you all for being here today and for your support of Senior Lobby. Our MC, Janine Vanderberg, will take over from here. Janine is a tireless, and I mean tireless, advocate for changing the way we talk, think, and act about aging and ageism. So, Janine.
Thank you, Bob.
And thank you, everyone. Let me ask you, how many people are here for the first time? Raise your hand. Fantastic. How many of you would never miss this? You're always here. Okay, so I'm seeing some of those same hands go up. Really interesting. But I think that's important to underscore what Bob just said, that it is going to take all of us to create the kind of communities and state that we need to adjust to that new reality that you just saw. So my name is Janine Vanderberg. I'm with Changing the Narrative in Colorado. It's a campaign, as Bob mentioned, to change the way Coloradans think, act, and talk about aging. In Colorado, it is funded by Rose Community Foundation and Next 50 Initiative, and I want to recognize Diana McPhail, the CEO of Next 50, who I saw, there she is. Okay, thank you, Diana. And this is important because of Next 50's initiative. We are able to take this initiative around the state of Colorado. Speaking of which, I want to remind everyone that this event is being live streamed, so when you make comments or anything, people will hear you in all parts of the state. And if you are available on live stream now and you run into some technical problems, Karen has told me that the full instructions are on coloradoseniorlobby.org, coloradoseniorlobby.org. And I'm thrilled to be in this room with all of you because changing the narrative in part means showing that people of all ages do care and do recognize that we have a fundamental demographic change and that we are willing to work together to do it. So it's not us versus them, it is all of us. And on that note today, we've got an incredible agenda. So I'm going to go through briefly who we're going to hear from, and then we're going to see a very cool video. If at any point you can't hear me, please raise your hand. Okay, we're good. So I'm going to give some brief remarks. We're going to have an extraordinary panel who are going to be illustrating some of the different kind of innovations that are going on right now in Colorado about helping all of us as we age and making our communities better. Then we're going to hear from Roberta Ray of Lifelong Colorado about efforts of AARP and the state to make sure that all of the communities that we live in are age-friendly, and I'm really excited about that. That is going to be so much to take in that then we are going to do a break. It is going to be a short break, and I'm going to be relentless in ringing the chimes to make sure everybody is back in their chairs by 10:50 because we have the governor and the attorney general and a lot of other stellar people, legislators, panelists coming in. We'll wrap up by hearing a day in the life of the legislator, and we will close at promptly 12:35. So with that, I want to introduce our friends over here from Metropolitan State University of Denver's Met Media, which I'm just learning is a newsroom that does a variety of media. It is student-run, and it has been student voices at MSU Denver for over 40 years. So again, I think it's another great illustration about the importance of all of us of every age coming together, and I'm going to turn it over to you all.
To get into that 65 plus, and so it's kind of a fun transition to watch and see if Colorado manages it well.
No.
I was a little bit, I'm not.
No.
We're now at a point where more of us are over 60 and 65 than are going to be, that are under 20, and that's forevermore.
I would say that there's still sometimes a lack of information in terms of understanding. I think a lot of the media sometimes portrays Colorado and other places as growing. But what we haven't seen is that we've actually seen this slowdown in growth, especially in our youngest population.
The thing is that health
healthcare in particular is going to experience this huge boom of the need for aging services in the next 5 years in particular. As faculty, it's really our responsibility to help students realize it's a huge field, and it's such an important area that we're really going to need their outside of the box thinking in order to create solutions to address the health needs that are going to continue to arise in this population.
I think we need to think about this in terms of how all ages are able to live and thrive in our communities. So it's how do we design our communities? How do we design our homes? How do we prepare our workplaces? How do we prepare our workforce? All those sorts of issues need to be on our mind as we're thinking about this demographic shift.
We've got to think very strategically as a state with this diminishing population, slowing birth rates. How are we going to find the labor force to fill positions? How are we going to make sure that that population is educated, qualified, can fill these positions that are coming in?
The reality is that in order for us to address the needs of this population, we're going to have to come at it from different angles, different sectors. So you're not just doing direct care. We're going to need people who are thinking about housing and transportation, all of that has an influx or an influence into healthcare and the healthcare needs of the population. So I think that's the excitement, and that they can really take some of their creative ideas and come up with solutions for the population.
Wasn't that fantastic? You can applaud now.
Thank you. That was great. So I also think that this video is a great introduction into the panel that follows, because it talks about how we need people, a community and a state in which people of all ages thrive, and we need everybody's out-of-the-box thinking. And so I am so pleased to introduce the members of this panel. And what I will ask you to do, panel members, I'm going to introduce you one by one, and if I could ask you, as I introduce you, to kind of walk up and take the stage, and then Bob will take it from there and moderate the panel. But it takes all of our vision and innovative ideas, and the people on this panel are at the leading edge of innovations in healthcare and technology, transportation and mobility, things that are so important to making an age-friendly state. So let me start with Kate Williams. Kate, hi, Kate. Kate Williams is the Executive Director of Denver Regional Mobility and Access Council. I will let her, when she gets to her part, to tell you more about Dr. Mack. But Kate, as the Executive Director, has had a long-time career in nonprofits, specializing in organizations that work with people with disabilities, older people, and people who are disenfranchised. She's a member of many transit-oriented organizations in the area and elected to the Board of Directors of Regional Transportation District. So Kate, thank you very much for being here. Okay. I am next going to introduce Kara Campini of Dispatch Health. Kara, there you are, okay. Kara started her career with 5 years in the labor movement, and that exposed her to impact that crushing healthcare costs and poor outcomes have on so many working families. She's dedicated herself to transforming how healthcare is delivered and how much it costs ever since. She was privileged to lead the National Strategic Partnership Development of Iora Health, and most recently oversaw business development opportunities in healthcare at Nurse Family Partnership. So welcome, Kara. Okay. So now we are calling Pat Kelly, CEO and founder of WellAssist. Is it Routinify? Routinify, I got it. I love it when that happens. Pat, I love your bio, Pat. Pat is the nephew of Helen, who turns 106 this April, the son of Virginia, who just celebrated her 97th. As a fourth-generation Coloradan, Pat is happy to return to his home state after 30 years in Boston. I hear you, that's where I grew up. Pursuing his career in the software industry. He's currently applying his skills and experiences to do his part to help all of us as we age put life in our years and to assist and relieve the burden on formal and informal workers. And he has recently founded Routinify. We're going to hear more about that. And round of applause for Pat. And then finally, I'm thrilled to introduce Clarence Burton, who's someone I recently met, who is the program lead for Senior Planet Colorado. He works with current and prospective community partners to deliver world-class technology training to older adults across the state. And his background prior to joining Senior Planet includes work in policy, campaigns, and education nonprofits. So welcome, Clarence. And I'm going to turn this over to you to moderate this fabulous panel.
Okay, folks, so we can start now with Miss Kate Williams. And she's going to tell us a lot more about Dr. Mack than we probably know today. So take it away, Kate.
Hello, testing. Okay, that's the first technology test for the day. Can you turn on the microphone? There's some information in the back. Probably, if anybody's ever seen this before, raise your hand. How many people recognize this? Look at that. Thank you. You made my day. Dr. Mack is not a doctor any more than Dr. Cog is a doctor. We are the Denver Regional Mobility and Access Council, and we were formed over 10 years ago now as a project of the Rose Community Foundation and Colorado Health to help older adults and people with disabilities find ways to get around. That's where the MAC comes from. That's mobility and access. And it's very interesting to us to find that 10 years down the road, one of the buzzwords of the older adult community, the city and county of Denver, Dr. Cog, the presidential candidates, is mobility. Mobility is the new buzzword for transportation. And I think that that has to do with the fact that the way people get around is changing. It's not just transportation that we used to think of, Bob, as trains or buses. It's all of the ways that people move. Here's one for you. I would think that most of you were told by your parents to never get in a car with a stranger. Right? Everybody's laughing because they know where I'm going with this. Today, you get on your smartphone and you call a stranger, and the stranger comes and gets you in his car. That's called Lyft and Uber. There's some other really interesting things going on with transportation, but I think I'll let the rest of the panel introduce themselves before I speak, or should I go on speaking? I can talk all day. Not a problem for me. Okay. How many of you have tried a service called Drive yet? I don't know how they're staying in business because I think they're great. So you drive your car to the Denver airport, and right outside of the Denver airport is the Drive location. You hand them your car and your keys. They take you to the airport. You fly away to wherever you're going to fly away to. And when you come back, your car is clean and full of gas. You pay no parking fees. You get a full tank of gas. You get your car cleaned, which is probably usually what I need the most. And somebody else uses your car in the meantime. Well, you got insurance. I've been doing it for over 6 months now, and I've never had a problem. So it's, and I'm okay if you don't approve of Drive, but what I want you to look at is the novelty of the concept. So 2 years ago, if I had sat up here and told you that your state legislators would be zipping up and down the 16th Street Mall on an electric scooter, you would have thought I was nuts, right? But I can tell you that the head of Dr. Cog and I recently had a race to see who could get from the Dr. Cog building down here to the Capitol in the best amount of time. He took the free mall shuttle, thank you, RTD, and I took a scooter and I won. So, I'm the proponent of saying that I don't think we're going to have to worry about parking, because by the time it gets to be any more of an issue than it already is at $18 a parking spot today, you and I are all going to be wearing jetpacks. And then we won't have to worry about how well we walk or how fast we scoot or anything else. We'll just, pull the little thing and away we'll go. That sounds inconceivable. But in fact, technology is changing the way we move and the way we interact so fast that it is literally impossible to imagine where we will be 2 or 3 years from now. It used to be, who remembers the Jetsons? Okay, how many of those things that were in the Jetsons are happening today in our lives? And that was a futuristic cartoon, but I'm still waiting for to get in the little box, and all my molecules twinkle like they used to do in Star Wars. And then I'm going to pop up in my office down the road. And I think that can happen in my lifetime. So the point I'm about now in terms of mobility and access is I want everybody in this room to be open to something that has never occurred to you before. Because if we don't learn to move with it, we're going to get left out. And the technology is moving on, but my mission and the mission of the Denver Regional Mobility and Access Council is to keep the people in all of that, to make sure that all of us are able to benefit from the concepts that are being developed now. So I want everybody to be involved. I want you all to go try. Let me give you some other ones. So Dispatch Health, she's going to talk to us about it, but it's in my presentation. They come to you. They bring healthcare to you. Your Fitbit. Anybody wearing a Fitbit? Who's wearing a Fitbit? Hold your Fitbit up in the air. Yeah, look at all of you. See? I don't have mine on. It will help you sleep now. It tells you how many times you wake up and what your sleep rhythms are. How about Silvernest? Who knows about Silvernest? Okay, so Silvernest can pair you in your home with somebody who can provide the things that you need. For example, you could get a live-in driver. Woohoo! I need a live-in pool boy. You can get somebody who will help you with your housekeeping or with your cooking. And it partners young people who, as we know, are having a hard time finding a place to live that they can afford with somebody in my age bracket who's looking for some assistance. So all of these things are happening to us, and they're happening faster than we are aware. So that's my mission for the day, is to tell you all to pay attention, look around you, participate, and enjoy some of the fruits of the things that we are helping to drive. Thank you very much. Oh, and these are in the back, if anybody wants one.
You're welcome. All right, good morning, everybody. My name's Cara. I'm the Colorado Market Director with Dispatch Health. I was talking to some of you guys out there earlier. Who has used Dispatch Health in the past? We got a couple of folks. So you guys, you can go ask these folks if what your experience is like with Dispatch after the panel. So if you remember nothing else from my little chat, Dispatch Health is an urgent care that can come to your home. So who's gone to the ER in the past, let's say 5 years? Keep your hand up if your bill was over $500. Over 1,000, keep them up. Over 1,500, over 2,000. Oh my goodness, okay, I'm running out of breath. So Dispatch Health was founded by an ER physician in 2013 who frankly was experiencing a lot of the same things that you and I experience as a patient, but him from a professional perspective. That when you go to the ER, what's it like? You often wait quite a bit of time. You're a little bit nervous. Am I being over-treated right now? Or maybe I'm being under-treated, right? Because the provider is looking at the screen the whole time, and I'm not certain that they're really paying attention to me. There's a bunch of people coming in and out of the room. Do they know who I am, and have they read my chart? There's a lot of real sick people around me, and I'm a little nervous I'm going to get sicker by being here than I was when I walked in the door, right? And if you have kids, if you have kids, the ER is not exactly a fun place to be. And so that was really the reason why we founded Dispatch Health, was because while all of this is happening, 30 to 70% of the time, you don't actually need to be treated in an ER, right? You're there because your primary care doctor is closed, because it's after hours, because it's challenging, mobility is challenging, and so you needed to call 911 even though you're not facing a life-threatening or time-sensitive emergency. And so you end up in what is a very costly place to get care that truthfully does have a lot of downsides. Of course, we're not advocating to get rid of ERs. They are very, very important when you have a life-threatening or time-sensitive emergency, but a lot of time that we end up there, that's not really what we have, right? Are we going through slides? How are we?
More technology.
Oh, here we go. This is marketing right here. Our font is never on anyone else's computer. It's really fun. There we go. Okay, can you go to the next one? Thank you. Okay, so for those of you guys that can see, this is a really fun, simple chart that talks about where healthcare was provided starting in the 1930s. So that light blue circle up there, in the 1930s, 40% of hospital type care was provided in the home. So I love talking to seniors and to healthcare professionals because I get to preach to the choir. So who remembers when a physician came to your home? Anybody? Yeah. So what changed? Why is healthcare not in your home anymore? Insurance. Everybody loves to say insurance. We'll give them some of it, right? Another piece of it is technology. Now, when you go to the doctor, it's hard to go to the doctor without them doing either lab work, ultrasounds, X-ray, an EKG, something like this. And they didn't. When they started to develop this technology, it was really big, and the doctor couldn't take it with him in those black bags to your homes, right? It wasn't possible. As technology is improving, we're going back down the other direction, that by 2025, we're going to be at almost 30% of hospital-based care in the home again, right? And that's because, partly, a lot of this technology, we carry an EKG machine with us. It's this big. It's that big, that's it. We can do an EKG on your couch, and it's this big. So, while a lot of industries are really progressing to become really customer-centric, healthcare is one that's a little bit slow, partly for that liability reason, but for a lot of other reasons. But Dispatch Health really thinks that we can put the patient first and do what's best for the patient. Can we go to the next one? Okay, so a little bit of the logistics of how Dispatch Health works. So the way it works is you can call us to request care. You can also request care on our app or through our website. No matter how you request care, you're going to talk to one of our EMTs in our triage center. They're going to make sure that you don't have a life-threatening or a time-sensitive emergency, because if you do, you still need to go to the ER. And then we're going to send a team out to your home if your case is appropriate for us. And so you're going to see either a nurse practitioner or a physician assistant. They're going to bring an EMT along with them. And then there's a board-certified ER physician on the phone. So it's a team of 3. We typically spend about 45 minutes to an hour with our patients, which is one of the key things that makes us different from an urgent care, right? So we're founded by an ER doc that wants to reduce unnecessary ER utilization. And so we wake up, we hire our teams, we think of our clinical capabilities in terms of what are the reasons people go to the ER that they don't need to go to the ER for. Those are the things that we want to be able to treat in the home. So some of the common things that people call us for, and I like to go kind of head to toes because it's the easiest way for me to remember it. So migraines. So we can do IV fluids. We come with a small pharmacy of IV and oral medications, antibiotics, steroids, non-narcotic pain medications. So we treat a lot of folks for migraines, anterior nosebleeds. We have 5 ways, I think, that we can treat your nosebleed that won't stop bleeding. We are seen for all of the upper respiratory type stuff, especially during flu season. So we carry a nebulizer, so we can do that. Nausea, vomiting, and diarrhea. So we bring an iStat machine with us, which is the same lab machine that's used right away in the ER. So we can test kidney functioning, electrolytes, all that kind of stuff. What other good stuff? We have a nebulizer with us. We can air splint minor fractures. We can sew staple glue, so all kinds of cuts and stitches don't need to cost $3,000 anymore when you go to the ER. And we're not just for seniors. We treat patients as young as 3 months, and our oldest patient was 108. So in Colorado, we're in network with all of the major insurance companies. And we bill the same way that an urgent care would. So patients that are on Medicare, on average, are paying about $5.44 out of pocket for our care. Medicare Advantage, usually around $35, and commercial patients are usually paying around $40 out of pocket to see us. And so we're started here in Denver. We're in 11 markets now nationally, and we'll be in close to 20 by the end of the year. But in the Denver area, we go from Castle Rock to Boulder, Aurora to the foothills. And usually we're there between an hour to 2 hours after you request care. And then after the visit, we send all the clinical notes back to your primary care doctor. We're not a replacement for primary care, so it's really important to us that we're able to tuck you back in for that ongoing care. The next slide. Yep. Yeah. So we're half healthcare, and the other half is really technology. So we've built our own logistics platform to be able to accurately predict what time we're going to be at your house. So we overlay with Google Maps to know traffic. And then based on your age and chief complaint, we're able to identify how long we're going to be in your home so that we can tell the next guy what time we're going to be there. At the same time, we're communicating with our call center, with our ER physicians, with your primary care doctor, with Colorado's electronic health record. So this is a really critical piece of our model. So I think that's the high level stuff.
Thank you.
Yeah.
Thank you.
Okay, great.
Take it away, Pat.
Yeah, just waiting for the slides. It's Colorado Senior Day 2. So in prep for that, anytime I do business with somebody, I'm going to partner with somebody, I always want to know why do they do it? What brought them to motivate them to start this business or provide this service?
Into the microphone.
Oh, sorry about that. So I have two. On the left is Ginny, that's my mom. She turned 97 in February. And on the right is her sister, Helen, who yesterday celebrated her 106th. Yep, so I know what you're going to say. It's all about the genes, but anybody who's in this space knows that genes only contributes about 20-odd% to your longevity, and we'll have a little bit more on that later. But so my perspective is as an adult child caregiver, and that brings a couple things. The first is it's 24 hours a day, it's 365 days a week. You surround yourself with other people who help you in that, but they have a very specific siloed view. They're either wanting to remind about a specific item, or they're only in the home for a few hours a given day or during the week, or they're the primary care physician who really only sees these individuals once or twice a year. So they have a very vignetted perspective. I'm just as worried about groceries being in the refrigerator as I am about my mom making it to her physician appointment 6 months from now. The other thing is, the good news is I care. The bad news is I don't know what I'm doing. You make a lot of mistakes. The first thing all adult children do is they try to raise their parents. They raised you. They don't need to be raised. They need to be cared for, and there's a big difference. And that's why you need professional involvement. Next slide, please. When I quit putting in granny cams and Ring doorbells and trying to solve the problem by tech and just calmed down and took a look at what was actually working for them, it was patterns of behavior that they had fallen into. And I started to think, could I assist them in that regard? And so the core of what we do is Habits for Aging Well. We didn't create that. These are written down, lots of books, but the problem is there's no way to actually actuate them. So we use technology in a non-intrusive way to help start with the evening. How did somebody sleep last night? So we take off-the-shelf wearables, Garmin, Fitbit, and others. We start with sleep tracking, because anybody that's aware of dementia and cognitive disorders, sleep, probably the #1 thing you can do for yourself. And no, you can't catch up on sleep. All the good functions happen while you're at sleep. Now that you're awake during the day, activity and nutrition are big items, so we help people be active at the right times during the day. We assist them with nutrition and hydration, should that be a challenge. For some individuals, there may be med compliance issues, so we give them gentle nudges along the way. Socialization and mental actuation are big items as well. So the technology is there to assist individuals live the best life they can, and where they can use outside assistance, we have the notion of a care circle. A care circle is just what it sounds like. It's people around you that you trust, and you want them to be involved in a non-intrusive, non-invasive way to assist you in your care, or be alerted should something be a little bit off the rails and you might yourself not be aware of it. Next slide, please. Facts matter. That's the other big mistake that happens, particularly if you have other family members helping you. You make so many mistakes out of confusion of not knowing what's really going on. And so having the right data, not that you're trying to digitize mom or dad, but having data about what's really going on, what the plan is, how effective we are in delivering that plan makes a big difference, so that people who want to care now know when to care and what specific care they should provide. The other issue is care is still scheduled. Now, scheduling from a tech standpoint went out in the 1970s, 80s. It was called timeshare. We got over sharing valuable resources a long time ago, but we still do that when we provide health services, with the exception of Dispatch Health, which my aunt and myself have used on multiple occasions. So the point is that care should be delivered the same way we get all of our other services. It should be based on the facts. What is really going on? If somebody's scheduled to come in your house Tuesdays and Thursdays at 1, well, who said that Tuesdays and Thursdays at 1 are really when mom needs assistance? She might need a hand at Wednesday at 3 in the afternoon. The other problem is it's metered in hour blocks. And who says that the care really is more, maybe they only need a 5-minute touch. They need to talk to somebody as opposed to an hour block. And since it's metered in hour blocks and we compensate in hour blocks, we incentivize people to give multi-hour blocks. Any in-home service provider does not want to take the 1-hour shift. It's not cost effective for them. They want to do the 4- and 5-hour shift. So the whole thing's broken in terms of resource allocation and what are we short of? Caregivers. Next slide, please. Remote care. So lots of, I don't want to start the big bun fight around televisits, telehealth, and remote care, but it is important. We do provide it. We currently are providing it in a non-skilled service environment, although in the Canadian environment, I'll come to why we're in Canada in a moment, we are using it for a skilled service environment. We use off-the-shelf, quote, consumer grade, but they are FDI certified devices to continuously monitor blood pressure, blood oxygen saturation. By the way, my Aunt Helen at 106 has a 98%. Anybody that tracks that, I wish I had 98%. That 5% point would take several minutes off of my time, but 106, 98%, so clearly the furnace is working well. Glucose monitoring and weight. We don't require that people set up applications or anything like that. They just have to turn the device on and everything else is automatic. That data gets then put into a safe, secure place for utilization by family members as well as the aging adult themselves who says they don't want to know what's going on in their own life. Next slide, please. So community care. It does take a village, and I know all these habits for aging well and it takes a village. These are all, we all know that. Well, if we all knew that, how come we're not doing it? So that's one of the things about things that are thumpingly obvious is people typically don't do the thumpingly obvious. We're here to help do the thumpingly obvious if possible. So having family members in the care circle, professionals have a role, but what about other friends that might be available? They could live down the hallway, they could be a neighbor. How about instrumenting community care providers, helping hands, and other individuals who do a great job, but they don't know when they should be there, and they have more of a scheduled environment. But the bigger crime here is we have sidelined the best generation of caregivers ever created, the seniors themselves. We require, if they want to give care, we say, get in a car and drive to somebody's house. No. Use the system, talk through our smart display device, have a voice conversation, help somebody socialize, and during that conversation, help them around some life activity during the time. So we need to captivate, not only make the professional caregivers more effective and efficient, but we also need to captivate the other people in the environment, the community, and the seniors themselves to provide care. So why Canada? And I keep mentioning Canada as if you know. So we're a Denver-based startup. Funny thing happened right after we started. We got a little call, was from the government of Canada, the province of New Brunswick, which is on the Atlantic side of Canada, inviting us to come up and try what we were doing in their environment. I'm not here to have a discussion about socialized medicine versus other alternatives, but there is a slight difference in the payer models that affects how aging adults are cared for. So in that marketplace, we are fortunate to pull together a team of gerontologists, researchers from the University of New Brunswick, St. John, as well as professional caregivers. We piloted our technology in true clinical environments up there. Went general available, and I'm now bringing it back home. So we are launching Canadian Care, but Colorado Cares too, here in this marketplace. So we're going to focus on the Denver-Phoenix corridor to start. We have a slight different spin here, so the technology can be consumed by family members. So adult children are the ones who typically, at least in the US, buy this type of technology. But we also have a staff of clinicians in the Canadian marketplace that will have a televisit with mom or dad through the smart display, help do a proper assessment, build a care plan with you, and provide oversight and monitoring of that should it be necessary. So with that, I'll give you back a few minutes of your time, and thank you for hearing me out.
Get this one going. All right. How is that? Is this on? No? How about now? Oh, that came through. All right. Well, we'll get Senior Plant just has one slide up there. I'll share a little bit about our nonprofit, and then I want to spend just a few minutes before we take questions actually talking about, I think, some of the big ideas that push our program's thinking, our nonprofit's thinking, that ties together what the other panelists have been talking about, and then hopefully guide us into the Q&A. So Senior Planet, we provide free technology training for older adults, both 5, 10, and 20-week courses, workshops, lectures, both at partner locations and at technology-themed community centers that we build. And that is important work, but I think it's just part of the solution, and I'll get to that in a moment. So to start, I think what I'd like to do is have everyone think of an obstacle that you're going to need to overcome in the next 48 hours. And I'll give a pregnant pause there. And now think of an obstacle that you'll need to overcome in the next 6 years. That brings us to 2025. Right. Now, for the majority of folks, I bet that you thought of something that in some way will need to be met with technology as either a solution itself or as part of the solution. And we now live in a world where technology, and I think we see in the theme of what the other panelists have put forward, is not an option, really. It is fundamental to both achieving our day-to-day tasks, as well as meeting our aspirations for the future. And if we accept that as true, I think that really challenges us to change our mind, really a mind shift, if you will. Because if we live in a society where technology is a necessity for our long-term well-being as well as meeting our day-to-day tasks, that means we have to change what I would argue are a group of negative and false assumptions that we have about older adults and technology. So, and to put this home, and I'll get to this in a moment, I really think that this means building entire systems that think differently about how we meet the technology needs of older adults, as well as how we give them the skills to access those needs. So what we don't want is to build amazing applications that solve problems, or build new systems and programs, and then put them up on a high shelf, package them nicely, and not think about how we give folks a stool to actually access any of those services, those applications, those system-wide or society-wide programs. And I think we're really in danger of doing that both for the cutting-edge technology that is to come and is in the works, and I think we'll talk a bit about during the panel, but it's also true of the solutions and technology that is already out there. So how does Senior Planet do that? So we are building a movement of technology, digitally empowered older adults through, as I mentioned, yes, in-person programming and training. Yes, also technology-themed community centers. And then also building community for older adults. And let me talk a little bit about what that means, because I think there's three pieces I'd like to touch on. So one is environment. You have to create environments where older adults feel comfortable learning. And this will be a little bit of a challenge maybe for some of the folks in the room. I think often what we see is that when we create spaces for older adults, technology is a secondary thought. We often create spaces that have no technology in them, or when we provide technology, it is, we'll just get some old computers, some of those leftover laptops, a few generation old iPads. That doesn't prepare folks to access the resources that they need. And I think it also communicates something of what we think about people, about the resources that we provide them, and people internalize that. And we see that in our work, which is why we always try to provide the cutting edge technology. So we have to think about environments. The second piece I'd like to add, and really pushes our thinking, is education. So as a society, we have to create educational practices, and I think many of these practices are already known. We have to apply them, that live out the philosophy, the belief that all people are capable of learning. I think if we took a show of hands, everyone would agree with that, but I don't think we all often demonstrate it, and I'll give you an example. when an older adult shows up to one of our classrooms or one of our lectures, one of our workshops, a common story that I hear is my daughter or my grandson bought me this smartphone, this iPad, this laptop, and it's really great, and I want to use it. But every time I have a challenge, they take it out of my hands, they fix it, and they give it back to me. And then I see some nodding heads, so this is likely familiar. And then the next time they face a challenge, what do you know, a surprise, they don't know how to solve it because they haven't actually been empowered to really learn the technology. And part of that is it's not an evil intention. I've done it myself, even knowing that with my own grandmother. You know, let me just grab the phone and fix that issue and give it back to you. But that's not how people learn. And so if we're really going to empower individuals, we have to think about how we, after creating those spaces, provide educational opportunities that train and empower and aren't just IT. And then the third piece I want to talk about is community. So community is a big theme for us. Almost all of our programming takes part in a group. We don't do a lot of one-on-one. And that's not that one-on-one isn't needed, say in-home technology training or technology services. It's because we know that no person grows as an island, that we all grow as part of a community. And on top of that, you know, for Senior Planet, we call it is aging with attitude. It's about creating a philosophy, a tech savviness, and an idea about aging, giving folks the tools to support that idea, and then putting them in a community of their peers that also feel empowered and excited to learn. And the magic that you see when you create that type of environment, all three of those pieces together, is incredibly transformative. And when you combine those three things, we know that the evidence shows that you reduce social isolation, you promote independence in aging in place, you build confidence, and you actually change attitudes about what people think about what it means to age, which is really the heart of the issue. As we all know, technology is going to be central to our future. It is no longer what I'd like to call a vertical or a pot of, you know, it's one of the check boxes, let's think about technology. We have to start thinking about technology as a foundational layer. So as we seek out either to give folks access to the resources that they are already present, or as we create these really unique and exciting solutions, we have to understand that access to technology also has to be met with adoption education, the stool. And I realize that the high shelf is probably a bad analogy for someone as tall as I am, but bear with me. You have to give people the stool to actually access that. And I realize I'm running over time, and so I'll close on that thought and welcome the Q&A part of the section.
Thank you.
Yeah.
So we do have time for a couple of questions, and I'll start with one. So as you know, probably know, Governor Polis has created an office on saving people money on healthcare. Where do you see your organization fitting into that? And anybody who would like to start?
I'll take a shot at that. So demand-based, provide care by the numbers, give the right intervention at the right time. We force people to take the most expensive intervention possible, or what typically happens is they just keep it to themselves until they can no longer ignore it. So provide the help when necessary. A long time it's just dealing with socialization and loneliness, or just a gentle nudge or a conversation. So preventative care is the number one, and frequent touch points.
I want to speak to that same subject. Everybody awake now? One of the big problems that happens in our region is that people are not able to get to their medical appointments. to do follow-up, and that's based on a lack of transportation options. So we are seeing now that anybody who's involved in transportation is trying to address that. To keep people healthy, they need to do follow-up. It's not just the initial call, it's the follow-up afterwards. And one of the things that I think everybody in the room should know, our local transportation agency, RTD, is 100% accessible. 100% accessible. And there are a couple of fare options. If you show an ID, you can get on RTD as an older adult for half price. So that means a local trip is $1.50. And there is now a 3-hour window. So if you pay your fare and you can get where you're going and do what you're going to do and get home within 3 hours, you only have to pay one fare. So a lot of people don't know that. So we're moving toward helping people be able to get where they need to go so that they can stay healthy.
Yeah, I think I'll say, so because of the way that Dispatch Health is structured, we don't have a brick and mortar facility that our patients have to pay for. I think stitches are a great example. We often go to the ER for stitches. Those of you that had your hands still raised at the $2,000 mark for the ER visit, you don't need a heart surgeon to do stitches, and that's who you find at the ER, right? So Dispatch Health is able to provide the right level of care for patients' acuity in a setting that is much lower cost. So I think in terms of lowering healthcare costs, Dispatch Health is a really important piece of it. If you look at all of the dollars that Americans spend on healthcare, usually around 4 to 5% of it is primary care. All the rest is specialists, hospitals, that type of thing. And so we have a real opportunity to cut that number down because we're operating in one of the highest cost care settings. We're operating as an alternative to one of the highest cost care settings. If that's what they need, yeah.
Did you guys hear the question I asked? If you get stitches, if they come and stitch you up, do they come back 10 days or 2 weeks or however longer to take the stitches out? Because that's part of the follow-up care that we're talking about. Thank you.
Yeah, so we certainly can. Although we're not a replacement for primary care, so often it is suggested that you see your primary care doctor after us. But we see a lot of patients that that's really hard for. And if your option is, well, I need to get these out, I'm going to go to the ER, we're there.
It touches on the point I was really just closing on, which is many of the solutions that we see being created are technological solutions. The potential of dispatch and other technological solutions to save the government money is huge. But you have to have folks who feel comfortable using the technology. Too often, we find folks who really feel like they've been left out on an island. There's a sea of services out there that they'd like to access, but no one's taken the time to make them feel comfortable video conferencing, for example. And so providing the matching of both the resource, the access with the adoption education is just so important.
So I've heard many comments about using technology today, and we fully expected that, of course. But I guess the question I have for you is, have you run into any issues with internet access for people to use this technology? And could you talk a little bit about that? That'll be our last question, by the way. So.
We have this technology down. Okay, so the Denver Regional Mobility and Access Council, Dr. Mack, we are in 9 counties. We are basically the same footprint as Dr. Cog, and we do see that there are issues with access. There are people in Evergreen, for example, who don't have the same kind of access The interesting part is we also see the other side of that, which is if you walk, let's try it here. How many people in this room do not have a smartphone? 1, 2, okay. So that dynamic goes through all socioeconomic levels, is most people, including 4-year-olds and 5th graders in lower economic areas, do have access to a phone, a smartphone, she said, holding hers in her hand. And a smartphone most of the time has cell service, and most everything that we are talking about is available by cell service. And most public libraries offer classes in how to use your smartphone.
Sort of. So whoever drove the van up here from Pueblo, you're parked in the parking lot and you're going to be towed very soon. So whoever that is, please go move your van. Thank you.
I'll say that connectivity actually isn't super important for our patients. You can request care by calling us just as easily as you can through our app or through our website. Who it is important for is, though, our clinical teams. If you look at the areas where we service, one limiting factor is, does our team have connectivity there? For our team's safety, we need to be able to geolocate them and know where they are and that they're okay. We need them to be able to communicate easily with our team, with primary care, with emergency services if needed, and with Colorado's health exchange. So we're improving our platform so that it has an offline mode, but still we just really are dependent on being able to interface with the rest. So if you look at our service area, a piece of it is technology. The other piece of it is, we're acute care. We need to be able to get to your house in an hour or two, otherwise the model doesn't work. And so going into rural areas, which we talked a lot about out there, presents a challenge if folks are less dense. Drive time in between patients takes longer, which means that wait times take longer for our patients. And so it's kind of those two pieces, one that's easier to solve than the other, I think.
So in briefly, our smart displays are what are referred to as edge devices, meaning that they do not require continuous internet connectivity. We do that for 2 reasons. One is to dampen people's concern about being surveilled and paranoia associated with cloud connected devices. And the other one is to be able to operate in a lights out, electricity was out. So we do need occasional internet connection, and if there's no wired service there, then we use LTE or cellular data connectivity. But the best thing is to not build your app to be reliant on the cloud, but build your app to be self-sufficient and report only when necessary.
Yeah, Senior Planet does bring both technology to locations, so through mobile labs, mobile sites for technology, as well as mobile hotspots, so we can provide internet access when we do programming. That, of course, is a drop in the bucket of the bigger issue. What I would add to what's already been said is an acknowledgement of how this issue affects certain communities to a greater degree. So in addition to age, you have rural communities, communities of color, and low-income communities all have less access to both technology and internet access. So when we think about solutions, we should think about them in an equitable sense. So I'd also add that to the thinking.
So back to the theme that we're all running on here, that it's amazing what is available. I want you guys to all know that there's a new thing going on nationwide that people are calling Lyft or Uber instead of an ambulance because it gets there faster and it costs less. So that is an idea outside of the box that is self-perpetrating, and it comes back to technology and what really works. And tied to that, there's a program that we haven't talked about here called Go Grandparent. Who knows Go Grandparent? Well, a lot of people do. You do not have to prove that you have a grandchild in order to use it. It's available for any age. It is a brokerage of Lyft and Uber that works with a telephone, so you don't have to have a smartphone. You don't have to have an app to use Go Grandparent. You could, say again? Yeah, they have a website. They totally, Go Grandparent. But what they will do that is of interest in relation to how we're talking about caregiving is so I can call Go Grandparent for my mom, and they will report to me, A, that they're at her house and she's not coming to the door because she doesn't want to go to the doctor, or B, that they have her in the car and see that they've dropped her off. So as fast as we can think of solutions to the issues, some of them are happening organically.
Okay, we'll be wrapping up here now. Thank you all very much. A couple quick comments. So as we've seen, mobility is about a lot more than transportation. It's also about access to the transportation and from the transportation. And it may be about the service coming to you rather than you going to the service. So technology is becoming an enabler of better health care. We've all heard that. CSL is engaged in a couple dozen bills in this session on health care, and many of them have a technology component. So anyone can learn the basics of technology. You can see Clarence about that. So what is one thing that all the panelists have talked about, and that is good internet access. So Ronan, I don't know if you have that map available. And I'll be really quick about this. Maybe it's not there. Okay, never mind. No, it's okay, never mind. So what I was going to show you is there's a website in the Governor's Information Technology Office. It's a broadband office, and you can go on there and you can look at at a map of Colorado broadband coverage. And when you do that, you will see that there are many areas of the state that don't have broadband coverage, many others that have very slow internet coverage. And that's something that we need to all be concerned about, and we're very concerned about it at CSL. And there's a bill moving through this year to improve rural broadband coverage. But I don't know how far that's going to get, but we still have a lot more work to do even beyond that. So thank you once again to all the panelists. This has been great, and thank you all for listening. And we're going to move on.
Terrific. Thank you so much. What I took away from this was we started by talking about the need for out-of-the-box thinking, and that came out in the video. And the spirit of innovation that we already have going on in Colorado is really positioning as well. So I want to introduce now Roberta Ray from AARP Colorado, who is going to talk to us about one of the most exciting things that I think is happening in Colorado. It's the move for age-friendly communities throughout the state. I've had the opportunity of listening to Roberto. He and I have done a road trip to Montrose, Colorado together. And anyway, so really looking forward to what Roberto has to say. And I just, once Roberto is done, I will come back up. We will announce a very brief break with some other instructions. And I'm wondering, maybe we can pull that map up from the internet during break, because it's a very cool map.
Great.
All yours.
Good morning. Good morning. I'm going to give you a brief overview of Lifelong Colorado, and I'll wait until this comes up. Okay. September of last year, the governor announced the creation of Lifelong Colorado, and the initiative is both a standalone state of Colorado initiative to make the state even more age-friendly than it is, and at the same time, it's the organizational vehicle for the state of Colorado to participate in the AARP network of age-friendly states and communities. And you can go to the next slide. The driving impetus of AARP's work in Lifelong Colorado in addressing the need to make the state and the communities in it even more age-friendly are the statistics and data that we've heard from other speakers that both the state and the country are getting older. 1 in 3 Americans is age 50 or older right now. And I'll add that in Colorado, about 40% of them are AARP members, so that we have a substantial presence in just about every community in the state. And that by 2030, 1 out of every 5 people in the U.S. will be over 65. So again, to underline the fact that every community in the country is getting older, and Colorado is no exception. Next slide, please. For AARP, an age-friendly community, and we do use the term age-friendly and livable interchangeably, because as we've done work in the area of creating age-friendly communities over the last 5 years, we've come to realize that a community that is a nice place for people over 50 to live in, if it has great transportation, nice housing, good social service, good infrastructure, it really is a nice community for just about anyone of any age. So in a lot of ways, we tend to use the term livable community more frequently in a number of instances than age-friendly, because it underlines the fact that we're talking about communities that are good for anyone, regardless of your age. AARP's definition of an age-friendly community is one that is safe and secure, that has affordable and appropriate housing and transportation options, and has supportive community features and services. And that those resources in turn enhance personal independence and allow residents to age in place. As we've done the work, we've come to realize that in particular the area of housing, when we started working on age-friendly, the emphasis was on accessibility in housing. Last 3 or 4 years, it's shifted very strongly in the direction of affordability. And that's certainly the case pretty much all over the state of Colorado. But it's pretty much the case everywhere we work. One of the relations that we've noticed is that a lot of times as we do the work and as communities get to be known as being age-friendly, good places to live, development is that you get gentrification. So that for us to create a community where our members can actually age in place involves addressing the issue of affordability and non-displacement, so that they can actually age in the community that they've been living in. Next slide, please. You can see the map of age-friendly communities. This is actually a bit dated. I think there's 8 communities indicated there in Colorado. There's actually currently 12. And nationwide, we have about 350 communities and 3 states. The state of Colorado was the 3rd state to join the Age-Friendly Network. We're proud of that. New York and Massachusetts were the first 2. And it really indicates a commitment on the part of the state administration to recognizing and devoting resources to making our state, the whole state, an even better place than it is for people of all ages. Next slide. So these are the current age-friendly communities in the state. There's 12, and I'll read them because it's kind of small print. Denver, Larimer County, Colorado Springs, Manitou Springs, Boulder County, Pitkin County, Eagle County, Fruita, Summit County, Jefferson County, Garfield County, and Las Animas. And as you can see, they're a really good reflection of the diversity in size and geography of the state. As I said, we've had 4 join since the beginning of this year, and we expect to really increase the size of the network as more communities realize the benefits of joining Lifelong Colorado and the AARP network. And I'll point out that at this point, the clearest route to joining Lifelong Colorado is to become part of the AARP network of age-friendly communities, since it's got a pretty clearly defined process and set of commitments attached to it. When you join the AARP network of age-friendly communities, you automatically become a part of the Lifelong Colorado network of age-friendly communities, and also of the World Health Organization network of age-friendly cities. So that's one of the benefits that communities get. They get recognition for the work that they're doing and the accomplishments that they've had. And I would urge you that if you are in a community that is on this list, and if you want to get involved in age-friendly efforts in your community, please contact us. You can contact me, actually. And if your community is not in that list, and if you wish to explore the possibility of it joining Lifelong Colorado and the network of age-friendly communities, again, please feel free to contact us. Next slide. So the process and the requirements for joining the age-friendly network are pretty simple and very flexible. To join the network, the primary requirement, and in some ways the hardest one, is to get a letter of commitment from the political leadership of the entity that's joining the network. In the case of Colorado, it was getting a letter from the governor committing the state to embarking on a process to make it more age-friendly. In the case of cities and counties, it's the mayor, city manager, or county board of commissioners. And that is to get a significant political investment on the part of the community in the process. The other main requirement is an application listing the goals and what the community wishes to accomplish, and a commitment to develop a 5-year plan. Now, for the 5-year plan, AARP has a framework for analysis that's built around the World Health Organization's 8 domains of livability, which includes, pretty obvious ones: transportation, housing, how much social participation exists in the community, social interaction, opportunities for civic participation, etc. Those are listed not as requirements that communities actually have to address. They're listed mainly to get the communities to thinking about what exists or doesn't in their community and what their priorities as communities are. Each community that joins is actually free and actually encouraged to look at their community and make a list of goals that makes sense for them. And there's a tremendous amount of diversity within Colorado in the scope of the plans that communities have developed and on the priorities of the plans. And that's as it should be. Every community is different, and every community is going to have a different goal. So next slide. When Governor Hickenlooper created Lifelong Colorado, he set a couple goals for it. One was to make Colorado the age-friendliest state. filled with age-friendly communities, neighborhoods, streets, businesses, places of worship and organizations, parks, recreation facilities, and more. He also set some pretty specific goals, that by the end of this year, there would be 20 additional communities in the network, and that by 2023, there would be 100 new communities in the network. So it's a pretty large challenge, but we're pretty confident that if we can't completely meet it, we can come pretty close. So the advantages of becoming part of Lifelong Colorado and the network is that, one, you get recognized by the state of Colorado, AARP, and the World Health Organization on your community's achievement. You have an opportunity to participate in a network of other similar communities, learn from their best practices. You get access to consulting organizations that both AARP and the state have access to. One of the initial goals that was set up in Lifelong Colorado was to get additional funding for the initiative to have additional staff and be able to do grants. Unfortunately, that didn't make it through the legislature this year, but we're pretty optimistic that in future years we will be able to get it through, and that we can patch up any lack of resources through other resources. You get the opportunity to work with state agencies. For Lifelong Colorado, the Department of Local Affairs is the key agency that supports the initiative, and the Governor's Senior Policy Advisor on Aging, which is a position that was created through a grant by the Next 50 Foundation, and who you will get to meet later on in the program, is the lead staff person for the Lifelong Initiative. So there are a lot of benefits to be that communities gain from participating in the process, and we really urge you that if your community is in and you want to get more involved in it, or if your community is thinking of joining, to please get in contact with us, and we'll be happy to really work with you to make that happen. Next slide. So that is the basic overview, and as I said, this is a work in progress. When a community becomes a part of the network, it does not mean that in joining it has become an age-friendly community. That's really kind of an ongoing goal. It means that they've made a commitment to become a more age-friendly community. And I think with Lifelong Colorado and the opportunities that it creates for greater collaboration among Colorado state departments and communities across the state, that that'll become a more an increasingly realizable goal for everyone in the state. Thank you.
Thank you so much. So I never get tired of hearing of Lifelong Colorado and age-friendly communities. And Roberto, I want to thank you for especially mentioning the importance of livable communities for people of all ages. How many, just raise your hand, how many people in this room care about affordable housing in their communities? Okay, look around. Is it just older people or younger people who care, right? So there are issues like this that we all care about. The best example I think about livable communities, and it occurred to me after my husband had hip replacement surgery, and all of a sudden we realized we were not going to be able to cross Federal Boulevard in the amount of time that the street light allowed. And it occurred to me also that, you know, a mom in a stroller or dragging a 2-year-old around had the same issues. So when we all commit together to age-friendly and livable communities, we're doing this for all of us. So thank you. We are going to take a break. I know we've been promising it. It is now going to happen, but I'm just going to make one announcement first. Actually, I'm lying. I'm going to make two. The first is, please thank our sponsor. A big round of applause for Disability Law Colorado. It takes a lot of effort and time to do something like this. We have a number of sponsors. They're in the program, but Disability Law, prime sponsor. The second thing I want to do, each of you should have on your tables, there are these little postcards. If any of you are photographers, amateur photographers, and want to help change the narrative by taking pictures of older people who are, like many of you in the room, actually involved in stuff, you're volunteering, you're running businesses, please look for more information. We are running a photo contest now through May 6th to get photos of older people who are, like all of us, actually doing stuff. So if you've got photos, you can take a photo. You just learned about technology, get your phone, get selfies of all of you at the table, submit them to our photo contest. I will be asking you to come back at 10 to 11. It doesn't matter what is on your watch or your phone. It will be when you hear you need to be back in your tables. We've got some great guests coming up, the governor, the attorney general, legislators, a lot more. So a lot exciting. You are now officially on break. Thank you. This is your 5-minute warning. Hi, Stephanie. A 5-minute warning to be back in your places with sunshiny faces at 5 till. 5-minute warning to be back in seats. It is now time to return to your places. If I can ask everyone to please sit down. We have some amazing guests who are joining us, And if I can ask everyone to please sit down. Quiet voices so we can hear our speakers who are about to arrive. Would you take your seats, please? This includes people in the back. I'm sure our guests will stay for autographs later. You don't need to accost them now. Okay, I want to introduce Ed Sealover. I hope I am pronouncing your name correctly, Ed. Okay. Ed is going to be joining us. Thank you. We've got some quiet here. Ed, if I can ask you to join me. So Ed, for those of you who have not met, has been a reporter at the Denver Business Journal since 2009. Among other things, he covers state government, transportation, economic development, hospitality, tourism, and the beverage industry, a Colorado favorite. The 2019 legislative session is the 13th that he's covered for 3 different papers, including the Colorado Springs Gazette and the Rocky Mountain News. And this guy's the real deal. Throughout his career, he's received 126 awards from press associations in 5 different states in categories that include beat reporting, political reporting, public service, and investigative reporting. And the guy does, it sounds like he does a lot, but you also have a real life. When not covering the interaction of government and business, he lives in Wheat Ridge with his wife Denise and children Lincoln and Jane, and has also written 2 books, Mountain Brew, A Guide to Colorado Breweries, and Colorado Excursions with History, Hikes, and Hops. There you go. Who better to do this?
Well, thank you all for coming today. I am hoping to keep my time on the stage short because what we really want to do is hear from the officials who are making the decisions that are impacting your lives every day. We've got a series of statewide elected officials who will be coming up here, and if they can sneak out, possibly legislators coming over to talk to us too. But we wanted to start out on this roundabout of officials by introducing the state treasurer, Dave Young, and the state attorney general, Phil Weiser. And I'll keep talking, Phil, as I see you're putting your tie on in the back. Both Treasurer Young and Attorney General Weiser are newly elected, were sworn into office in January, and both of them have set about working on programs that affect seniors, particularly working on programs to protect seniors from exploitation and other scams. And so with that, I'm going to just turn this over to them, and if we have time afterwards, maybe we can throw a few questions their way as well. So please welcome up Treasurer Dave Young and Attorney General Phil Weiser.
Where do you want us? Do you want over here? Down over here?
Mics are now on. That would help. I was saying, apparently the Treasurer's Office didn't get with the program on Denim Day, which is, I think it's an international deal where people make contributions to support important work defending women, and it is actually a cause for wearing denim. So in our office, a lot of people wearing denim today, but not in the Treasurer's Office.
Actually, in the Treasurer's Office, people are wearing denim. The Treasurer is not wearing denim today. So I will have to, I think when I was in the legislature, when we wore denim, we had to pay a fine, which was really just a contribution.
Yes, exactly.
To the effort. And so I guess I'll have to double down on my contribution because I didn't wear denim. So there you go.
There you go. All right. You want to go first?
Sure. Hey, it's great to see everybody here. As Ed indicated, I'm Dave Young. I'm the newly minted state treasurer. Can I get away with saying that?
Yes.
Yeah, we came in, both Phil and I came in and were sworn in on January 8th. And as you know, I was a state representative for many years before that, representing a House district up in the Greeley area, northern Colorado. And so my Greeley folks are in the House. I see them, and I've worked with a whole lot of other people in this room over the time that I was in the legislature. And so it's a real pleasure to be invited back in this capacity in order to be able to advance the cause of making sure our seniors are well cared for and financially protected as they move forward in life. And so being a member of the seniors community, I'm acutely aware of the dilemmas that we run into sometimes. But before I jump into kind of the details of that, I just want to tell, how many of you actually knew there was a treasurer? Oh, weird. You're much more adept than most groups I talk to. Because a lot of times people don't even know, that there's a treasurer. And then I always like to take a few minutes to really talk about what we do in the treasurer's office. I know I don't have a lot of time, but let me just tell you that we have a tremendous staff in the treasurer's office. It's split between two locations. We have about half our staff in the Capitol, and the other half is a couple blocks away. The group that's a couple blocks away is working on unclaimed property. Now, how many of you have actually been to the Great Colorado Payback website to see if you actually have unclaimed property? Not as many hands. You all should go to the, and let's see, I've got to put my reading glasses on so I can make sure I get the address right. But it is colorado.findyourunclaimedproperty.com. And if you just Google the Great Colorado Payback, you'll get to the right website. But you should check for yourself. You should check for your family. You should check for friends to see if they have unclaimed property there. Sometimes you don't even know that a bank has taken your savings account and transmitted it to our office. There's a period of time that's called dormancy, and if no transfers in and out of that savings account occur, your bank account may be transmitted to the treasurer's office, and you may not be that aware of it. And the same is true on safety deposit boxes. We get those boxes that are not getting rent, they'll be transmitted to us also. But we hold that in trust, and so you can claim it. It's a pretty easy way online to actually claim it. It may take some additional documentation, but I want to encourage you to make those claims. We have a lot of people that are working to make sure we can get that money back to you or that property back to you. The 15 or so people that are working in the Capitol are actually working very diligently to make sure your hard-earned tax dollars are safe. Do you like the sound of that? Yeah. We have people that are working on banking and accounting. I don't know how many of you balance your checkbooks once a month? How many of you balance them once a week? How many of you balance your checkbook every day? Well, pretty good on you. We do that in the treasurer's office for the entire state of Colorado every day. We balance the checkbook to make sure we know exactly how much money we have and it's all accounted for. And the reason we do that is because we want to ensure that your money is safe, but at the same time, you don't make a lot of money on interest in a bank account. And so every available dollar we can, we push to our investment crew that's also in the Capitol, and they're working with the markets, particularly the bond markets and corporate paper, to ensure that, in fact, every dollar we can be invested. In this past year, our current rate of return is about 2.7%. And so that's pretty good. It's a lot better than you just making a savings account. So there's a humming machine inside that treasurer's office, minute by minute, accounting for the dollars and making sure they're safe and well invested, and you should be very proud of the work that's being done. I also sit on the PARA board. How many people are members of PARA in here? Okay? All right, or you know somebody. So I am one of 16 trustees that work on the PARA board to ensure that PARA is a safe and soluble entity in the state of Colorado, and I think we still have some more work to do to make sure that it is where we want it to be, but I think it's on a good pathway. And so one of the big things that we're working on, of maybe 2 or 3 big things, is this issue around financial literacy. And it's a big overarching issue. When I went back to Washington, D.C. with the National Association of State Treasurers in February, that was a big topic of discussion. The fact that we aren't really providing enough training for people all the way from the early years in elementary school all the way through life to ensure that people really understand how to take care of their money. And so I'm committed as state treasurer to actually create this big overarching financial literacy program in the state of Colorado that will touch the lives of everybody at some point or another. But I am really excited the fact that I'm joining our tremendous AG, Phil Weiser, and our governor in this effort on the task force in order to move forward, particularly for seniors, the work on financial protection and literacy so that we can ensure that every Coloradan is well cared for. So I'll leave it at that. There'll be more questions, I'm sure, but I want to turn this over to Phil.
Thank you, Dave. It is such a pleasure to be here and great to be partners with Dave Young, who's a true public servant. 2020 is going to be around the corner, and 20% of our population will be age 65 or older. We have to be there for older Coloradans. What is powerful about Senior Lobby Day is you don't give up. If it snowed out once, you're back. If it snowed out twice, you're back. I will say, when you look at lots of indicia of grit, citizenship, stick-to-itiveness, whatever words you want, older Coloradans and older Americans hang in there.
Right.
You vote, you stay engaged, you balance your checkbooks more than most people. It is an incredible source of strength for our society. And older Coloradans also can sometimes be vulnerable to different forms of scams that keep getting more and more sophisticated. I'm going to see if I can one-up Dave here. Who here gets robocalls? So I was talking about what we're doing in my office to address robocalls with a local TV station and got a robocall while talking about robocalls.
What?
Not kidding. And they film me talking to the person, and I'm like, why are you calling me? And the person is like, can you tell me who this is? I'm like, you called me. I hate to give this advice, but it's true. If you don't recognize the number from a call, even if it looks like it's your neighborhood, let it go to voicemail.
Right.
If it's legitimate, they will leave a voicemail. There's going to be technology that will help protect you. We're going to help get the word out about tech technology. The reality is we're living in a scary world with a lot of people who would take advantage of others. That's what this task force is about. It's about us in Colorado working as a team to protect each other, and particularly more older Coloradans. We have this partnership. We've got a number of people. I want to give an acknowledgement here. Lena Fishman. Stand up, Lena. Come on. Give it for Lena. She's spearheading these efforts, whether it's stop fraud efforts, whether it's how to protect people from identity theft, and whether it's financial literacy, something we were just talking about. Lena is there. Also, one of Lena's partners, Bob Booth, leads our Medicaid fraud unit, which also does a lot of work around abuse of older Coloradans. If people are trying to bill for services or abuse people in whether it's a nursing home or another facility, our office will go after them and hold them accountable. And we need your help. When you hear about people, whether they're a healthcare situation or others who are engaging in a scam, let us know. This is how we solve things here in Colorado. And we are so fortunate to have a innovative, collaborative problem solver extraordinaire as our governor. Ed, what's the program? Do we get questions? Does he speak?
Yes.
What do you want to do?
Real quick before he comes up, I just wanted to ask you a little bit, when you're talking about the task force, talking about the problems you're going to solve, what is it a matter of? Is it a matter that we need to enforce regulations that are already in the books a bit more in the state, or are you all looking for help in putting
I think the honest answer is we're not sure yet what the range of solutions we need, and it's possible that in some cases we might need new forms of legal protections. I also know it's true that we have a lot of protections that aren't operating in practice, and we've got to do better. And I'm a big believer in democracy as a team sport, which means different agencies need to work together and people have to work together. I'll give you a quick example about that. A program that I helped start at the University of Colorado called the Governmental Entrepreneurial Leadership Accelerator Program was asking the question, how do we better serve older Coloradans, allowing them to age in place because it gets harder to go physically out for services. The idea that emerged was the Denver Connect van, which is now in operation with support from our office and the Denver Office of Aging. That didn't take a new law, but it took a new innovative solution to help enable the existing laws to work for people.
Yeah, if I can jump in. You know, I think what we've discovered as technologies improve that sometimes our laws don't keep up with them. And it's kind of like your virus protection software on your computer. If you don't keep it up to date, then you become vulnerable to attack. And sometimes you're not aware that you're supposed to be updating it, and then all of a sudden something happens and everybody mobilizes, your computer guy comes in and helps you fix it. But if we're really smart about it, then we can actually make sure that we are updating all the time. And I think that's what this task force can do, is actually begin to look at our laws, see if they're still applicable. If not, make recommendations to the legislature to carry some bills that would update them. And there may be big gaps that we're not even aware of that are occurring. So, but I agree, not everything has to be done by law. I think that there is just a lot of education that we can do, and that's why I'm committed to be a good partner in this relationship, because if we really educate people effectively, then I think we have a better opportunity to provide individual by individual protection. You ought to have somebody who's an educator on the task force.
How about a math teacher?
Former math teacher, and I actually taught, when I was in school, I taught the stock market game, which was the Denver Post stock market game for K-12 students. And I was amazed at how rapidly they began to adapt and understand the financial markets and work in that. And I think giving people real life opportunities to engage in some instruction that actually helps them understand what they need to do to be financially sound and secure is an important thing.
Good. And one last one for either of you. What can the folks here do to help keep you informed of what's needed out there? What's the best way to be able to transmit their concerns, their issues to your offices?
COAG.gov. That's it. Go to that website, and if you aren't getting satisfaction, my email address is coag@coag.gov. We need to hear from you. When people are scamming or engaging in abusive behavior, if we don't know about it, we can't address it. So please, let us know.
And I don't want to speak for the task force in general, but I suspect we'll have some meetings around the state where people can come in and visit with us and tell us what's going on in their lives. My email address is dave.young@state.co.us. And so you can email me, and if you are encountering some kind of issue or uncover some kind of problem that we need to be aware of, you can send that to me. We're also on the first floor of the Capitol, right there in the West Foyer. All of you are always here, so come on in on the first floor and visit us in the treasurer's office. And if you have any...
And bring cookies if you can.
Cookies are always helpful. But please come in and visit us and carry these stories to us personally. It always helps.
Great. Well, thank you all very much. Let's give a hand to Attorney General Phil Weiser, Treasurer Dave Young. Great. And as they are exiting the stage, we will bring up someone who probably needs no introduction, but just in case, I will mention Governor Jared Polis was sworn in January as Colorado's newest governor. Before that, he spent 10 years as a congressman representing the Boulder and Fort Collins area before deciding to come back to a land of sanity here in Colorado. And I know that he will be teaching or telling us a little bit about his efforts toward the senior population. Thank you, Governor Polis, for being here.
Thank you, Ed.
Thank you, Ed. And thank everyone for being here today. Hello. You know, this is exciting. I want to thank Colorado Senior Lobby Board. There's so many volunteers that organize this event, and thanks for all coming down. This is important for you to meet and interact with your state government. It's incredibly important. I want to discuss a little bit about how we meet the challenges and opportunities of our aging population and make sure that people can live fulfilling lives and contribute to our great state regardless of their age. As you know, at a 20,000 foot level, there's been big increases in life expectancy. Isn't that wonderful? Really is. My dad turned 75 last week. My mom turned 75 next month. It's wonderful to be able to celebrate with them. It's great that they're able to take the grandkids a day or two a week. It's a great relief to us. That's what often what I say, you know, one of our top agenda items is full day kindergarten, which we're going to get this fall, which we're very excited about, free full day kindergarten. But what's in it for grandparents is, while it's wonderful to take that grandkid, that 5-year-old or 6-year-old, a day or two a week, 5 days a week is a little bit of an imposition, right? So I know my parents are thrilled, and I know many grandparents are thrilled that free full-day kindergarten will be a reality, no longer having to either loan their kids money to pay for full-day kindergarten or volunteer at 12 o'clock every day to pick their grandkids up. You know, Colorado is a great place. We have, in fact, the third fastest growth rate in the country in the over 65 age group, and that's because a lot of people want to retire in our state. We have dynamic cities, we have safe and livable communities, we have beautiful public lands, we have a healthy lifestyle. We offer a lot, and that's one of the reasons that more people flock to our state for their golden years. And it also underscores the importance of the challenges and opportunities that come with a aging population. You know, when we think about the challenges associated with aging, a lot of them revolve around community and how you can have a strong community, avoid loss of community. To some, that means family. To others, you're not living in the same state as your kids or grandkids. It means friends. It means clubs. It means organizations. It just means who are you spending time with that informs our lives and gives meaning to our lives. We want to make sure that people can continue to go places they enjoy. People can participate in activities that they enjoy. We want to make sure that we can do everything we can to prevent seniors and people of all ages from withdrawing or being isolated, both of which are really connected to loss of both physical as well as mental health. And through the Lifelong Colorado Initiative, the previous administration made a strong progress in helping to make Colorado communities as age-friendly as possible. And in many ways, it was a large part that initiative that led AARP to recognize Colorado as one of only 3 states to be a member of its network of age-friendly states and communities. So we're very proud of that. And while cities play an important role, while counties play an important role, the state also has a very crucial role to play in helping our aging population have access to resources that they need to live fulfilling, dignified, exciting, positive lives. And, you know, an aging population means a lot of things. It puts pressure on folks in the sandwich generation between caring for older relatives and their kids. It can lead to tighter labor markets and also opportunities for seniors to have senior-friendly part-time work that may be able to augment their own incomes if they choose. And, you know, there's a number of steps that we can take as a state. First of all, of course, I'm thrilled that our wonderful Lieutenant Governor, Diane Primavera, who helped establish the Strategic Action Planning Group on Aging, by the way, SAPCA, will continue her work on this critical issue as the head of our Office of Saving People Money on Healthcare. By the way, I hear that seniors on a fixed income like to save money on healthcare. Is that right? Just wanted to make sure I was right on that. Yeah, we're working on a number of different initiatives, including importation of prescription drugs from Canada. Obviously, the Medicare piece is federal. We don't get to improve that. Boy, if they let us, we would, right? First of all, starting with negotiating for prescription drug rates. My goodness. Just to you know, right now, there's 2 big federal payers, the VA administration and Medicare. The VA is allowed to negotiate for prescription drugs as a payer. Medicare is not. So even today, the same exact prescription drug through the VA system, they're paying 30, 40% less for than the Medicare reimbursement rate. which obviously affects the out-of-pocket as well. And also, just within the program, the type of benefits that can be offered. If there was less spent on prescription drugs, there could be better benefits in other areas. I'm also glad to report that we've promoted John Hickenlooper's aging advisor, Wade Buchanan. He was doing such a good job as the aging advisor. He is now our policy director for all of our policies. And we have also, I don't think replaced is the right word, Wade is irreplaceable, but we found a successor to Wade as our aging advisor, Janice Blanchard, who's here. Janice, could you stand up and just so everybody knows who you are? And she just started last week. And we are excited to elevate at the highest level aging issues and quality of life issues for people of all ages. And we're really interested in seeing what we can do to help families provide care and support of aging loved ones, to help people age in their homes and in place and not be forced to move, to make sure that we up the quality of caregivers and access to caregivers. And of course I know from experience personally that of course it's hard work. And, my late grandmother, June Polis, who was fortunately with us till the age of 96, had relied on caregivers during her final years. She was unable to perform normal tasks around the house physically, and it was, we couldn't have been able to enjoy and have her enjoy getting to know her great grandkids without the wonderful caregivers who helped her have meaningful support in her latter years. And sometimes it's the simple stuff that makes a difference. We need to do a better job supporting the work on the simple things at the state level. Again, a lot of the action is cities, counties, but the state as well. And the concept is simple. Every Coloradan should have access to a quality, accessible lifestyle, obviously starting with healthcare. That's one of our top priorities, is reducing healthcare costs, and age-friendly communities, support for caregivers, really help us go upstream to prevent problems from happening before they happen, reducing the cost when they do happen, and reducing the need for critical interventions by investing in preventative and ongoing support. And that's why we established the Office of Saving People Money on Healthcare. We really fully intend to do that, and obviously that affects seniors in a significant way, who in many ways have a higher percentage of what is likely to be a fixed income, often going to healthcare related expenses. Some of the progress we've already made, we already signed a bill that requires pricing transparency from hospitals, so we can identify some of the cost drivers and the irrationalities and try to address the way that hospitals do pricing. We are hoping that the state will succeed in creating a reinsurance program. Again, many of you are on Medicare, but this is for people in the individual market. Certainly people who retire at 62 or 61 before Medicare kicks in, thrown on the individual market. Absolutely critical that we bring down those rates, because that is that provider if you don't have your coverage through a big employer and you're not yet on Medicare. We're looking at importing prescription drugs from Canada. We're also focusing on prevention, and we're focusing on the links between behavioral health and physical health, which are so important for people of all ages. And we're looking at some of those interventions that can be successful around identification and addressing and treatment for behavioral health issues. So there's a lot that we can do. Today I wanted to present you, and I will, a proclamation. That's one of the things I get to do as governor, proclamations. So I'll just read it to you here. It says, whereas Colorado senior citizens play an important advocacy role by educating and lobbying for legislation benefiting our state, whereas our senior citizens contribute to many facets of our lives, including impacting social and public policy, whereas Colorado senior citizens make use of their time, talents, and resources in support of programs advancing the needs of the less fortunate, whereas our senior citizens share a wealth of experience and knowledge in the development of public policy, whereas Coloradans are today encouraged to recognize and celebrate our senior citizens for their enduring contributions to our state. Therefore, I, Jared Polis, Governor of the state of Colorado, do hereby proclaim April 24th, 2019 as Senior Day at the Capitol. Congratulations. And happy Senior Day at the Capitol. May all your wise words be heeded by our friends in the legislature. Thank you.
All right. Well, thank you, Governor. I know the governor's schedule is short, but don't worry. The governor's administration is going to be talking with us in just a second here after they get done with some photos. But while she's doing that, I will explain to you who is coming up next. The new senior advisor on aging in the governor's office is, as mentioned, Janice Blanchard. Janice has worked for over 25 years at the local, state, national, and international levels. From academic to government to nonprofit organizations to promote a positive culture on aging. She has served as the director of the Denver Office on Aging and has spent the past 10 years as a consultant and public speaker dedicated to finding innovative solutions for senior housing, community development, and the arts. So we want to hear a little bit about what is going on in the Governor's Office of Aging, and then maybe throw some questions the way of Janice here. So Janice Blanchard, welcome to the